I recently helped a patient who saw me for high iron when in fact it turns out he had iron deficiency anemia from too much therapeutic phlebotomy. So phlebotomy or blood donation can be helpful for iron overload or testosterone replacement therapy because that can cause high hemoglobin and thicken the blood. However, the risks of therapeutic phlebotomy are that it can be overdone, and I'm going to tell you how to determine if you need it and how often. If you find this information helpful, please like and subscribe so more people can watch this video. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. I've been blessed to have seen over 100,000 patient visits over the last 39 years, many of whom have gut and thyroid issues. And abnormal ferritin is a common thing I see, as this patient came in with high iron, joint pain, inflammation, fatigue, poor muscle endurance, weight gain, high blood pressure, bloating, gas, heartburn, constipation. He was doing testosterone injections twice weekly for years, and his doctor told him to start donating blood because TRT can raise hemoglobin and thicken the blood. So he did it every 2 weeks for the prior 2 months, and he was only checking his hemoglobin as a marker. Hemoglobin is an oxygen-carrying protein in the red blood cell, and many people confuse this with iron. So when you go donate blood, they check your hemoglobin, and if it's too low, they say, oh, your iron's too low, you can't donate blood. However, hemoglobin and iron are two different things. Hemoglobin contains iron, but it's not the same thing as iron. So he was only checking his hemoglobin level. And when I ran initial blood tests on him, it turns out he had iron deficiency anemia. He had low red blood cells, low hemoglobin, low iron, low saturation, low ferritin of 14. Plus he had markers of metabolic syndrome above optimal. Glucose, A1C, uric acid, insulin, inflammatory markers, plus many other findings. So I'll tell you minimum tests you need to determine if you need to donate blood and how often. And then after that, I'll go over how I helped this patient get better. The minimum test you should get is CBC, Comprehensive Metabolic Panel, ferritin, serum iron, percent saturation, TIBC, and then lipids, TSH, CRP, LDH, GGT, insulin, A1C, and uric acid, free T4, free T3. So that's initially the minimum to assess high ferritin iron overload. And if it's determined from there you would benefit from phlebotomy, then to determine how often you need it, instead of just checking hemoglobin and then running into an issue like this patient where he went too far and became very anemic, you want to do a CBC chemistry panel. And then the ferritin, iron saturation, and TIBC. So those 3 panels. And when you look at the whole picture, you may find that you don't even need phlebotomy, or if it is warranted, at least you can do it at the proper schedule so that you don't overdo it like this patient. After I got his results back, along with testing for deficiencies, toxins, infections, food reactions, and hormonal imbalance, I put him on a specific anti-inflammatory diet and the proper supplements, and the end result was his anemia and low ferritin cleared up in 8 weeks. And over the following months, the following improved to optimal levels: his glucose, A1C, insulin, uric acid, HDL, homocysteine. He dropped about 20 pounds, no longer needed blood pressure medication. It stopped the testosterone injections in the very beginning. And by 6 months, his testosterone levels were the same in the 500s as when he was on testosterone. He had more energy, less pain and inflammation, and his gut symptoms were better. The diet I put him on, I call the Free Diet. It's an anti-inflammatory diet I came up with years ago when I was discovering how to heal my own autoimmune, Hashimoto's thyroid, rheumatoid arthritis, IBS, fatigue, skin, and other health issues. I was able to get better, and I call it the Free Diet because it's free of not only gluten, but gluten grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. He also had additional food allergies that we had to address. And then supplements, I recommended the Functional 5, which is foundational 5 supplements I found most everyone needs, which is multi-fish oil, vitamin D with K, magnesium, probiotic. other gut supportive supplements, curcumin, cardiometabolics, and resveratrol and quercetin to help with inflammation and cardiovascular support, and other nutrients he tested low in. So with the free diet and proper supplements, he was able to feel better, improve his weight and blood pressure, normalize many of his lab values, was able to get off testosterone injections, and overall turn his health around. So if you have high ferritin or hemoglobin, don't assume that it's from iron overload and run out and start donating blood. Get the proper testing first, because if you find the root causes and have provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I'll put a video here that goes over the 7 causes of high ferritin and how to fix it, and free diet phase 1 food chart below. Feel free to like and subscribe so more people can watch this video, and I'll see you next time.